Jim is a cute little boy, but he is inattentive at school, always in a play mood, cannot sit and study, always make movements with hand and foot, as if he is nervous, twisting or turning his body, takes longer time to finish the homework or whatever task he got, or left incomplete. Easily get distracted with noise, sometimes running, sometimes climbing, and always talking and interrupt others. Why he is so? Let's have a look. ADHD, Attention Deficit Hyperactivity Disorder. It is also known as hyperkinetic disorder. It is characterized by severe form of long-term overactivity associated with inattention and impulsivity. It arises during childhood before 6 years of age, and it may continue into adulthood. It is the most underdiagnosed condition in children. In this video, symptoms, causes, diagnosis, management and tips for the parents regarding this ADHD is included. Let's have a look at the symptoms in children. Impulsivity. It means impatience, having a hard time waiting to talk or react. Frequently interrupt or intrude on others. Start conversation at inappropriate times. Overactivity or hyperactivity. Fidget and squirm when seated. Get up frequently to walk or run around. Run or climb a lot when it's not appropriate. Have trouble playing quietly. They talk excessively. Disruptive behavior. Most kids learn that refusing to listen to a parent, throwing tantrums, and hitting people have consequences. But some kids act angry and aggressive in spite of the consequences. Then inattention. Procrastinate, that is, they postpone or not complete the task like homework or daily chores, or frequently move from one uncompleted activity to another. Easily distracted by things like trivial noises or events that are usually ignored by others. Too wrapped up in their own thoughts to hear you. What are the symptoms in adult? Mood swings. Sometimes anxiety, sometimes depression, and they show low self-esteem. Problems at work. Trouble controlling anger, easily get frustrated, trouble staying organized, trouble concentrating doing things. Relationship problems. Impulsiveness, do something without thinking, often being late or forgetting things, then substance misuse or addiction, then postponing things or delaying, often seems bored. Usually the hyperactivity in adult is mentioned as restlessness. What are the causes? Genes and heredity. Genetics play an important role. 74% of the presence of ADHD in the population is due to genetic factors. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. In addition to genetics, scientists are studying other possible causes and risk factors. Brain anatomy and function. A lower level of activity in the parts of the brain that controls attention and activity level may be associated with ADHD. Then significant head injuries. Brain injury can be a cause of ADHD. Premature delivery. Low birth weight increases the risk of developing ADHD. Then prenatal exposure. Alcohol and tobacco use during pregnancy. Then toxins in the environment. It may lead to ADHD. For instance, lead in the body can affect child development and behavior. Psychosocial factors might make symptoms worse, especially in certain people. But the evidence is not so strong enough to conclude that these parenting or social and environmental factors such as poverty or family chaos are the main causes of ADHD. Diagnosis. The diagnosis can be made by a mental health professional like a psychologist or psychiatrist, or by a primary care provider like a pediatrician. Development assessment and neurological screen helps to rule out possible causes. Psychological assessment is to rule out other mental disorders. Educational assessment looks for whether there is reduction in the quality of school functioning. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents, teachers, and sometimes from the child itself. In children, diagnostic criteria should meet 6 or more symptoms of inattention, 6 or more symptoms of hyperactivity and impulsivity. And these symptoms are present in 2 or more settings such as home, school, or work. And the symptoms interfere with or reduce the quality of social, school, or work functioning. To diagnose ADHD in adults, only 5 symptoms are needed. Symptoms might look different at older ages. Comorbidity. It means 2 or more disorders occur at the same time with the primary disease. Comorbid conditions, for example, conduct disorder, learning difficulties, antisocial behavior, and depression, etc., can exist parallel with ADHD. And these coexisting conditions may interact and make each set of symptoms more severe. And hence, the diagnosis and the treatment will become difficult. Management. For younger children who is younger than 6 years of age, training for the parents is recommended as the first line of treatment before medication is tried. For children 6 years of age and older, the recommendations include medication and behavioral therapy together. There should be behavioral classroom intervention and school supports. The goals of behavioral therapy are to learn or strengthen positive behavior and eliminate unwanted problems or behaviors. A poor diet can worsen the symptoms. By making simple changes in what and how one eats, person may experience big reductions in distractibility and hyperactivity and their stress levels. Avoid sugar and junk food as much as possible. Make sure you include healthy protein at every meal. For drug treatment, stimulants and non-stimulants are given. Medications can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication but not to other. What works best can depend on the child and the family. Tips for parents. Create a routine. Try to follow the same schedule every day from wake up time to bedtime. Get organized. Encourage your child to put school bags, clothing and toys in the same place every day. Manage distractions. Turn off the TV, limit the noise and provide a clean workspace when your child is doing homework. Limit choices. Offer choices with only two options. For example, have them choose between this outfit or the other one. Do not complicate with more options. Be clear and specific when you talk with your child. Use clear, brief directions when they need to do something. Help your child plan. Use a chart to list goals and track positive behaviors. Use goals and praise or other rewards. Reward their efforts. Discipline effectively. Removal of privileges as consequences for inappropriate behavior rather than scolding or punishing them. Create positive opportunities. Finding out and encouraging what your child does well, whether it's school, sports, art, music, or play. Provide a healthy lifestyle. Nutritious food, lots of physical activity, and sufficient sleep are important. We have seen symptoms, causes, diagnosis, comorbidity, management of ADHD, and tips for the parents. Hope you like this video. Please subscribe for more videos with related topics. Thank you. Keep smiling.